If you are over 70 and your doctor just congratulated you because your blood pressure finally reached 120/80, I want you to pause for a moment and listen carefully. What I am about to explain may surprise you, and for many older adults it may even change the way they think about blood pressure forever. For decades we have heard the same message repeated again and again: lower blood pressure is always better. That idea became so deeply rooted in modern medicine that most people believe 120/80 is the universal goal for everyone, regardless of age. But recent research suggests that this belief may not be entirely correct when it comes to older adults. In fact, for people over the age of 75, aggressively lowering blood pressure to what we call perfect numbers may sometimes create more risks than benefits. A major study published in the Journal of the American Medical Association followed more than 15,000 seniors for 5 years. These were not specially selected healthy volunteers. They were real older adults living normal lives, many with common medical conditions such as diabetes, heart disease, or a previous stroke. Researchers carefully tracked their blood pressure and monitored what happened to them over time. The results were striking and, for many doctors, completely unexpected. Seniors whose blood pressure was kept extremely low, around the classic target of 120/80, actually experienced worse outcomes in several important ways. These individuals had a 28% higher risk of serious falls compared to those whose blood pressure remained slightly higher. They were also more likely to experience dizziness, fainting episodes, and kidney problems. Even more concerning, their overall mortality rate was higher than the group with moderately elevated blood pressure. In other words, the people with perfect numbers did not necessarily live longer or healthier lives. Now I want you to stay with me here, because this is where the story becomes truly important. The group of seniors who had the best survival rates were not those with the lowest blood pressure. Instead, the lowest mortality was seen in individuals whose systolic pressure, that top number, stayed between approximately 130 and 140. This moderate range seemed to provide the best balance between protecting the heart and maintaining adequate blood flow to the brain and other organs. Why would this happen? Why would slightly higher blood pressure actually be safer for many older adults? To understand this, we need to look at what happens inside the body as we age. Your cardiovascular system at 80 years old is not simply an older version of the system you had at 40. Several important physiological changes occur over time, and these changes influence how your body responds to blood pressure levels. The first major change involves the arteries themselves. As we grow older, our arteries gradually become stiffer. Imagine a brand new garden hose that easily expands when water flows through it. Now imagine that same hose after sitting outside in the sun for 20 years. It becomes rigid, less flexible, and less able to absorb pressure. Something similar happens to the blood vessels in our bodies through a process called arterial stiffening. When younger arteries receive a pulse of blood from the heart, they expand slightly, absorbing some of that pressure. But stiff arteries cannot expand as well. As a result, Slightly higher pressure may actually be necessary to ensure that blood continues to reach vital organs such as the brain and kidneys. If the pressure becomes too low, circulation to these organs can become insufficient. The second change involves something called baroreceptors. These are tiny pressure sensors located in the walls of your blood vessels. Their job is to constantly monitor blood pressure and send signals to the brain when adjustments are needed. In younger adults, these sensors work extremely quickly. When a young person stands up suddenly, gravity pulls blood toward the legs, causing a temporary drop in blood pressure. The baroreceptors immediately detect this change and trigger compensatory responses. The heart beats faster, blood vessels tighten slightly, and pressure returns to normal almost instantly. But as we age, these sensors become less responsive. They still function, but their reactions are slower and less efficient. This means that when an older adult stands up from a chair or gets out of bed, the body may take longer to correct that drop in pressure. If the baseline blood pressure is already very low because of medication or aggressive treatment, that temporary drop can become much more pronounced. This leads to a condition known as orthostatic hypotension. It simply means that blood pressure falls significantly when a person moves from lying down or sitting to standing. When this happens, the brain may not receive enough blood flow for a few seconds. The result can be dizziness, blurred vision, weakness, or even fainting. And when someone over 70 or 80 loses balance even for a moment, the consequences can be severe. A fall at that age is not a minor inconvenience. It can lead to hip fractures, head injuries, emergency surgery, weeks of rehabilitation, and sometimes permanent loss of independence. In many cases, the chain of events that leads to a fall begins with something as simple as standing up too quickly while blood pressure is too low. Now imagine a very common scenario that plays out in doctors' offices every single day. A 78-year-old patient comes in for a routine appointment. Their blood pressure is measured while sitting and it reads 145/86. According to many traditional guidelines, that number is considered too high. The doctor prescribes medication to bring it down. 2 months later, the patient returns. Their blood pressure is now 128/80. The doctor is pleased and decides to add another medication to bring the numbers even closer to the ideal target. After a few more months, the blood pressure reaches 122/76. On paper, this looks like a perfect success story. But what no one checks is what happens when that patient stands up at home in the middle of the night to go to the bathroom. Within seconds, their blood pressure may drop from 122/76 down to 90/60 or even lower. Suddenly the brain is not receiving enough circulation. The room spins. They reach for something to hold on to and miss. And just like that, a fall occurs. What began as an attempt to create perfect numbers can sometimes result in a completely different problem. And this is exactly why researchers are now emphasizing the importance of individualized blood pressure targets for older adults. In the next part, I am going to explain the exact blood pressure ranges that research suggests are safest for different age groups over 65, and I will also show you a simple test you can do at home tonight that could reveal whether your blood pressure is dropping too much when you stand. That test takes only a few minutes, but it could potentially prevent a serious fall. Now let's go deeper into the research itself, because understanding the details can completely change how you think about blood pressure after the age of 70. The study I mentioned earlier followed more than 15,000 adults over the age of 75 for approximately 5 years. These participants were divided into groups according to their average systolic blood pressure, which is the top number you see on the monitor. One group had systolic pressure below 120. Another group stayed between 120 and 130. Another between 130 and 140. Then there was a group between 140 and 150. And finally those whose pressure was consistently above 150. At the beginning, many researchers expected the lowest blood pressure group to have the best outcomes. After all, that assumption had guided medical practice for decades. But when the data was analyzed, the results told a very different story. The group with the lowest mortality rate, meaning the group that lived the longest overall, was not the group below 120. Instead, the best survival was seen in individuals whose systolic blood pressure stayed between roughly 130 and 140. Those with pressure below 120 experienced more problems than anyone expected. They had significantly higher rates of dizziness and fainting. They were hospitalized more often because of serious falls. Their kidneys were more likely to suffer injury due to reduced blood flow. And overall, their mortality rate was about 14% higher compared to those whose pressure stayed in that moderate range. On the other side of the spectrum, people with very high blood pressure above 150 did show increased risks as well. They had more strokes, more heart attacks, and more cardiovascular complications. So extremely high pressure is clearly dangerous. But what surprised researchers most was that extremely low pressure could also be harmful in older adults. The safest zone appeared to be somewhere in the middle. Not too high, not too low. A moderate level that maintains circulation while still protecting the heart and blood vessels. To understand why this happens, it helps to think about the body as a system that constantly tries to maintain balance. Blood pressure is not just a number on a screen. It is the force that pushes oxygen and nutrients through every organ in your body. Your brain depends on it. Your kidneys depend on it. Your muscles and nerves depend on it. When blood pressure becomes too high, that force damages delicate blood vessels over time. This increases the risk of strokes, heart disease, and kidney damage. That is why managing blood pressure during middle age is extremely important. But when blood pressure becomes too low, especially in older adults, another problem appears. The pressure may no longer be strong enough to push blood effectively to the brain when the body changes position. This is particularly noticeable when moving from lying down to standing. Gravity immediately pulls blood downward toward the legs. If the body cannot compensate quickly enough, the brain experiences a brief reduction in blood flow. For a young person, the body corrects this almost instantly. But in someone who is 75 or 80 years old, the response may be slower. If blood pressure is already low because of medication or aggressive treatment, that temporary drop becomes much more dramatic. The person may feel lightheaded, unstable, or momentarily confused. Sometimes they experience a sensation that the room is spinning. This is the body's warning signal that the brain is not receiving enough blood flow at that moment. Unfortunately, many people ignore these symptoms because they believe they are simply part of aging. They may say things like, "I just need to stand up more slowly," or, "That's normal at my age." But in many cases these symptoms are actually signs that blood pressure is being lowered too much. Another important factor that influences this situation is how medications are processed by the body as we age. When you were younger, your liver and kidneys were extremely efficient at breaking down medications and removing them from your system. But over time those organs naturally become less efficient. This means that medications often stay in the body longer and may have stronger effects. A dose that works perfectly for a 50-year-old may be too strong for someone in their late 70s or 80s. The medication can accumulate in the bloodstream, pushing blood pressure lower than intended. This is one reason doctors often start with smaller doses for older adults. But even with careful prescribing, the combined effect of multiple medications can sometimes lower blood pressure more than necessary. Now here is something very important that many patients never realize. Blood pressure measurements taken in a doctor's office only show a snapshot of what is happening at that exact moment. They do not necessarily represent what your blood pressure looks like throughout the entire day. Your pressure can change depending on activity, hydration, stress levels, body position, and even the time of day. It might be higher in the morning and lower at night. It might be stable while sitting quietly but drop significantly when standing or walking. This is why home monitoring has become such an important tool for understanding blood pressure patterns in older adults. When you measure your blood pressure at home over several days or weeks, you begin to see a more accurate picture of your average levels. Doctors call this trend data. Instead of relying on a single reading during an appointment, you can observe how your blood pressure behaves across different situations and times of day. This information helps doctors make much better decisions about treatment. And there is one particular test that can reveal something extremely important about your circulation. It is called the orthostatic blood pressure test. Most people have never heard of it, yet it can identify one of the most common hidden causes of falls in older adults. The test itself is surprisingly simple. In fact, you can perform it at home with a standard blood pressure monitor. First, lie down comfortably on your bed or couch and rest for about 5 minutes. This allows your circulation to stabilize. After those 5 minutes, measure your blood pressure while still lying down and write down both numbers. Next, stand up and measure your blood pressure again immediately. Do not wait more than a few seconds. Write down those numbers as well. Now compare the two readings. If your systolic blood pressure drops by more than 20 points, or your diastolic pressure drops by more than 10 points, this indicates orthostatic hypotension. In simple terms, it means your blood pressure falls too much when you stand up. This condition is far more common than most people realize, especially among older adults who take medications for blood pressure or heart disease. The danger is not always obvious while sitting or lying down. In those positions the numbers may appear perfectly normal. But when the person stands up and gravity shifts blood toward the lower body, circulation to the brain briefly decreases. That momentary drop can cause dizziness, loss of balance, or fainting. And if it happens unexpectedly, it may lead to a serious fall. In the next section, I am going to explain the specific blood pressure ranges that research suggests may be safest for different age groups over 65. These numbers are not rigid rules, but they provide a helpful framework that can guide conversations with your doctor about what targets may be most appropriate for your situation. Now that you understand why extremely low blood pressure can sometimes be dangerous for older adults, the next logical question becomes very clear: what blood pressure numbers should someone over 70 actually aim for? This is where modern research begins to paint a much more nuanced picture than the traditional, one-number-fits-all approach that many people grew up hearing. The truth is that blood pressure targets should change with age, overall health, and functional status. The ideal number for a healthy 45-year-old is not necessarily the safest number for someone who is 75 or 80 years old. Based on the most recent research and observational studies involving older populations, many experts now believe that a slightly higher systolic blood pressure range is more appropriate for seniors. For adults between the ages of 65 and 74 who are generally healthy, active, and independent, a systolic pressure between about 130 and 140 often provides a good balance. This range is low enough to protect the heart and blood vessels from long-term damage but still high enough to maintain strong circulation to the brain and kidneys. For individuals between 75 and 84 years old, the recommended range may shift slightly higher. Research suggests that systolic blood pressure between roughly 135 and 145 is often associated with better outcomes. At this stage of life, the body's physiology has changed enough that slightly higher pressure may actually support better organ perfusion. In other words, it helps ensure that blood continues to reach vital tissues efficiently. For adults over 85 or those who are frail, the approach becomes even more individualized. In many cases, systolic pressure between 140 and 150 may be entirely acceptable and sometimes even preferable. At this stage, preventing falls and maintaining independence may be more important than aggressively lowering blood pressure to textbook targets. One of the key lessons here is that medical care should focus on the patient, not just the number on a monitor. Two people of the same age can have very different health profiles. One may be strong, active, and walking several miles a week. Another may have multiple chronic illnesses, reduced mobility, or a history of falls. Their blood pressure targets may need to be very different. Let me illustrate this with a real-world scenario that doctors often encounter. Imagine two individuals who are both 81 years old. The first person has several medical conditions. They have mild heart failure, chronic kidney disease, and arthritis that affects their mobility. Their blood pressure during a routine checkup reads 158/88. Many guidelines might suggest lowering that number aggressively. But in this individual, aggressive treatment could carry serious risks. Multiple medications could lower the pressure too much, especially when the person stands up. Because they already have kidney disease, excessive blood pressure reduction could worsen kidney function. And because arthritis affects balance and mobility, dizziness could easily lead to a dangerous fall. In this situation, a doctor might decide that a more moderate target is safer. Instead of pushing the pressure below 130, they might aim for something closer to 140 or 145 while carefully monitoring symptoms. This approach protects the patient without exposing them to unnecessary risk. Now consider the second 81-year-old. This person is healthy, independent, and very active. They play golf twice a week, go for daily walks, and have no major medical problems. Their blood pressure also reads 158/88. The number is identical to the first patient's reading, but the overall situation is completely different. For this healthier individual, lifestyle changes such as improved diet, increased physical activity, and weight management might bring the pressure down to around 145/84 without medication at all. And that level might be perfectly acceptable for someone with their health profile. This illustrates one of the most important principles in modern medicine: treating the patient, not just the number. Blood pressure targets should always be personalized based on the whole person. Now let's talk briefly about the bottom number in your blood pressure reading, known as the diastolic pressure. Many people focus entirely on the systolic number, but diastolic pressure also plays an important role in circulation. During the relaxation phase between heartbeats, blood flows through the coronary arteries that supply oxygen to the heart muscle itself. If diastolic pressure becomes too low, the heart may not receive adequate blood flow. For older adults, diastolic pressure ideally remains above about 65 and usually between 70 and 85. When diastolic pressure falls below 60 on a regular basis, it can sometimes lead to fatigue, dizziness, or reduced circulation to the heart muscle. This is why doctors often look at both numbers together rather than focusing on only one. A systolic pressure of 130 might look ideal, but if the diastolic pressure is only 55, that could indicate that blood pressure has been lowered too aggressively. Another important thing to remember is that blood pressure fluctuates naturally throughout the day. It may be higher in the morning, slightly lower during the afternoon, and change depending on physical activity, stress, hydration, and sleep patterns. That is why a single reading taken during a doctor's appointment cannot tell the whole story. Home monitoring can provide a much clearer picture. When you measure your blood pressure at home at the same time each day, you begin to see patterns that might otherwise be missed. You may discover that your average blood pressure is actually lower or higher than what appears in the doctor's office. Some people experience what is called white coat hypertension, where their blood pressure rises temporarily during medical appointments due to anxiety. Others experience the opposite, where their pressure appears normal in the clinic but fluctuates more dramatically during daily activities. Tracking your numbers over time helps identify these patterns and allows your doctor to make more informed decisions about treatment. But numbers alone are never the entire story. Symptoms matter just as much as measurements. If someone frequently feels dizzy when standing, experiences sudden fatigue, or notices episodes of blurred vision or instability, these symptoms deserve attention even if blood pressure readings appear normal. In many cases, these symptoms may indicate that blood pressure drops too much when the body changes position. That is why the orthostatic blood pressure test we discussed earlier can be so valuable. It helps reveal how your circulation behaves during real-world movement, not just while sitting still. Now that you understand why blood pressure targets should change as we age and why extremely low numbers can sometimes be dangerous for older adults, the next step is learning what you can actually do in your daily life to manage this safely. Knowledge is powerful, but only when it leads to practical action. And the good news is that there are several simple steps you can take that dramatically improve how well your blood pressure is monitored and managed. The first step is something surprisingly simple but incredibly important. Begin monitoring your blood pressure at home if you are not already doing so. Home blood pressure monitors are widely available, inexpensive, and easy to use. Most pharmacies carry reliable models for around $30, and many modern devices automatically store readings so you can track your progress over time. When measuring at home, consistency is key. Try to check your blood pressure at the same 2 times each day, usually once in the morning and once in the evening. Sit comfortably in a chair with your feet flat on the floor and your back supported. Rest quietly for a few minutes before taking the measurement so that your body has time to relax. Then record both numbers, the systolic and the diastolic pressure, in a notebook or digital log. If you do this consistently for 2 weeks, you will begin to see a pattern. This pattern is much more meaningful than a single reading taken in a doctor's office. It shows your true average blood pressure under normal daily conditions. When you bring this log to your doctor, it allows for a far more informed conversation about whether your blood pressure is truly well controlled or whether adjustments might be needed. The second step is performing the orthostatic blood pressure test that we discussed earlier. This test is particularly important for people over 70 because it helps detect a condition that often goes unnoticed until a fall occurs. The test takes only a few minutes and can reveal whether your blood pressure drops too much when you stand up. To perform it, lie down comfortably for about 5 minutes. After resting, measure your blood pressure while still lying down and write down the numbers. Then stand up and measure your blood pressure again immediately. If your systolic pressure drops by more than 20 points or your diastolic pressure drops by more than 10 points, this may indicate orthostatic hypotension. Many older adults discover through this simple test that their blood pressure medications may be lowering their pressure too much when they stand. This information can be extremely valuable because it gives your doctor a clearer picture of what is happening in your body throughout the day. The third step involves something that is often overlooked in medical appointments: paying close attention to how you actually feel. Numbers are important, but symptoms tell an equally important story. If you frequently feel dizzy when standing up, if you notice sudden fatigue during the day, or if you sometimes experience a sensation that the room briefly spins, these are signals your body is sending. Many people dismiss these symptoms as simply part of aging. They may say, "I just need to move more slowly," or, "That happens to everyone my age." But these experiences may actually indicate that your blood pressure is dropping too low at certain moments during the day. Similarly, if you experience unusual weakness, mental fog, or difficulty concentrating, these could also be signs that your brain is not receiving enough blood flow during certain activities. These symptoms should always be discussed with your doctor, especially if you are taking medications that lower blood pressure. The fourth step is scheduling a dedicated conversation with your doctor about your personal blood pressure targets. This conversation is different from the quick check that often happens during a routine visit. Instead of simply asking whether your numbers are good or bad, it involves discussing what range is truly appropriate for your age, health conditions, and lifestyle. Bring your home blood pressure log with you. Bring the results of your orthostatic test if you performed one. Explain any symptoms you have noticed. When your doctor sees this information, it allows them to evaluate your treatment plan with much greater accuracy. Ask questions such as, "What blood pressure range is safest for someone my age? Are my medications necessary at the current dose? Could my target be adjusted slightly to reduce dizziness or fall risk?" These are thoughtful questions that help transform you from a passive patient into an active participant in your healthcare. The fifth step is speaking openly about medication side effects if you are experiencing them. Many older adults hesitate to mention symptoms because they assume nothing can be done. They may think that feeling tired, dizzy, or weak is simply something they must accept in order to control their blood pressure. But this is not always true. Doctors often have several options available. Medication doses can sometimes be reduced. Different medications can be substituted. In some cases, treatment targets can be adjusted to better balance cardiovascular protection with quality of life. Remember, the goal of treatment is not simply to produce perfect numbers on a chart. The goal is to help you live safely, comfortably, and independently for as long as possible. Another important point that deserves attention is the difference between occasional high readings and consistently elevated blood pressure. Blood pressure naturally rises during moments of stress, physical activity, or emotional excitement. A single reading that appears higher than usual does not necessarily mean you have a serious problem. What matters most is the average over time. That is why home monitoring and consistent measurements are so valuable. They allow doctors to identify long-term trends rather than reacting to isolated readings. Lifestyle factors also play an important role in maintaining healthy blood pressure. Regular physical activity helps keep blood vessels flexible and improve circulation throughout the body. Even gentle activities such as walking, swimming, or light stretching can provide meaningful benefits when performed consistently. Nutrition also influences blood pressure. Diets rich in fruits, vegetables, whole grains, and lean proteins support cardiovascular health. Reducing excessive sodium intake can also help prevent unnecessary increases in blood pressure. Hydration is equally important because dehydration can worsen dizziness and contribute to sudden drops in blood pressure when standing. Sleep quality should not be overlooked either. Poor sleep or untreated sleep apnea can influence blood pressure regulation and overall cardiovascular health. Addressing sleep issues may sometimes improve blood pressure control without additional medication. All of these steps together create a more balanced and personalized approach to blood pressure management in older adults. Instead of focusing exclusively on reaching a universal number, the goal becomes maintaining stable circulation, preventing falls, and protecting long-term health. At this point, you probably realize that managing blood pressure after the age of 70 is far more complex than simply chasing a specific number on a monitor. What truly matters is balance. Blood pressure must be high enough to maintain strong circulation to the brain, kidneys, and other vital organs, but not so high that it damages blood vessels over time. Finding that balance becomes more important as the body changes with age. One of the biggest misunderstandings many older adults have about blood pressure is the belief that the same targets apply to everyone. For years the number 120/80 has been presented almost like a universal rule. Many people feel anxious if their numbers are even slightly above that level. But modern research is showing that this one-size-fits-all approach does not always work for seniors. The cardiovascular system of an 80-year-old is not the same as that of a 50-year-old. Arteries are stiffer, pressure sensors respond more slowly, and medications stay in the body longer. All of these changes mean that extremely aggressive blood pressure control may sometimes create new problems instead of preventing them. This is why doctors increasingly emphasize individualized treatment. Two people of the same age can have completely different health profiles. One person may have diabetes, kidney disease, and a history of heart problems. Another may be extremely active and have very few medical issues. Their blood pressure targets should reflect those differences. For example, someone who has diabetes or a history of heart attack may benefit from maintaining blood pressure closer to the lower end of the recommended range because their cardiovascular risk is higher. But even in those situations, the reduction should occur gradually and carefully, with attention to symptoms such as dizziness or fatigue. On the other hand, an older adult who is frail or has difficulty with balance may need a slightly higher target in order to maintain safe circulation when standing or walking. Preventing falls becomes a major priority in these cases because a serious fall can dramatically affect independence and overall health. When we talk about falls, it is important to understand just how significant they can be for older adults. A fall is not simply a momentary accident. For someone over 70 or 80, a fall can lead to fractures, especially hip fractures, which often require surgery and long periods of rehabilitation. Recovery can take months, and some individuals never regain their previous level of mobility. Research has shown that many of these falls are related to sudden drops in blood pressure when standing. This is exactly why orthostatic hypotension is such an important condition to recognize. When blood pressure falls too quickly after standing, the brain receives less blood flow for a brief period. That moment of reduced circulation can lead to dizziness, blurred vision, or loss of balance. The simple home test we discussed earlier can be extremely valuable in identifying this issue. By measuring blood pressure while lying down and again immediately after standing, you can see whether your body maintains stable circulation during movement. If the numbers drop significantly, it may indicate that blood pressure medications or treatment targets need adjustment. Another important factor that influences blood pressure control is hydration. Many older adults unintentionally drink less water throughout the day. Dehydration can cause blood pressure to fluctuate and may increase the risk of dizziness when standing. Maintaining adequate hydration supports healthy circulation and helps stabilize blood pressure levels. Physical activity also plays a powerful role in maintaining healthy blood vessels. Regular movement improves the flexibility of arteries and helps the body regulate blood pressure more effectively. Even moderate activities such as daily walking, light resistance exercises, or stretching can improve circulation and overall cardiovascular health. Nutrition contributes as well. Diets rich in vegetables, fruits, whole grains, and lean proteins support heart health and help maintain stable blood pressure. Reducing excessive salt intake can also prevent unnecessary increases in pressure within the blood vessels. At the same time, balanced nutrition helps maintain energy levels and muscle strength, which are important for preventing falls. Another key concept many people overlook is the importance of gradual changes when adjusting blood pressure treatment. When medications are increased too quickly, the body may not have time to adapt to the lower pressure. This sudden change can trigger dizziness, weakness, or fatigue. Gradual adjustments allow the body's regulatory systems to adapt more smoothly. Communication with your doctor is essential throughout this process. Many patients hesitate to question their treatment plan because they assume doctors always know exactly what number is best. But medicine is not always that simple. The most effective healthcare decisions are often made through open discussion between patient and physician. If you monitor your blood pressure at home, track your symptoms, and perform the orthostatic test when appropriate, you bring valuable information to that conversation. This allows your doctor to tailor treatment specifically to your needs rather than relying solely on generalized guidelines. Remember that good blood pressure management is not about achieving perfection. It is about maintaining stability, protecting your organs, and preserving your quality of life. The goal is to keep circulation strong enough to support your brain and body while reducing long-term cardiovascular risk. Understanding these principles gives you a powerful advantage. Many people simply follow instructions without understanding the reasoning behind them. But when you understand how aging affects the cardiovascular system, you can participate actively in decisions about your health. Now let's bring everything together so that the message becomes clear and practical. If you remember only a few ideas from everything we discussed, these are the ones that matter most. Blood pressure management in older adults should never be about blindly chasing the lowest possible number. Instead, it should focus on maintaining a level that protects the heart while still ensuring strong and stable blood flow to the brain and other vital organs. As people age, the body's physiology changes in ways that require a more thoughtful and individualized approach. For decades, the medical community repeated a simple message: the lower the blood pressure, the better. And for middle-aged adults, especially those in their 40s and 50s, this message often holds true. Lowering high blood pressure during those years can significantly reduce the risk of heart attacks, strokes, and kidney disease later in life. But what the newer research shows is that the same aggressive targets may not always be appropriate after the age of 75. In older adults, extremely low blood pressure can sometimes reduce circulation to the brain, especially during standing or walking. This can lead to dizziness, instability, and fainting. Those symptoms dramatically increase the risk of falls, and falls in older adults can trigger a cascade of serious health problems including fractures, surgery, loss of independence, and long recovery periods. This is why researchers are increasingly focusing on what they call the optimal range, rather than a single universal number. The evidence suggests that for many seniors, a systolic blood pressure somewhere between about 130 and 145 provides the best balance. This range appears to support good circulation while still protecting the cardiovascular system. When blood pressure drops too far below this level, the risks begin to shift. Instead of protecting health, excessively low pressure may increase the likelihood of dizziness, kidney problems, and even higher mortality rates. On the other hand, when blood pressure rises above about 150, the risk of strokes and heart disease begins to climb again. The safest place tends to be in the middle. Another critical lesson is that symptoms matter just as much as numbers. A blood pressure reading may look perfect on paper while someone is sitting quietly in a doctor's office. But if that same person becomes dizzy every time they stand up, those symptoms provide important clues about what is really happening in their body. This is exactly why the orthostatic blood pressure test is so useful. By measuring blood pressure while lying down and then immediately after standing, you can detect whether your circulation remains stable during movement. If a significant drop occurs, it may indicate that treatment targets need adjustment or that medications may be too strong. Home monitoring is another powerful tool. Checking your blood pressure at home at consistent times of day gives a much more accurate picture of your average levels than occasional readings during medical visits. It also allows you to notice patterns and share that information with your doctor so treatment decisions can be more precise. Perhaps the most important takeaway is that you should never feel like a passive observer in your healthcare. When it comes to something as important as blood pressure management, informed patients are powerful partners in the decision-making process. Understanding how aging affects circulation gives you the ability to ask meaningful questions and have thoughtful conversations with your doctor. You can ask what blood pressure range is safest for your age group. You can discuss whether your current medications are still appropriate. You can mention any symptoms such as dizziness or fatigue that might indicate your blood pressure is dropping too low. These conversations help ensure that your treatment plan is tailored to your specific situation rather than based solely on generalized guidelines. Lifestyle also continues to play an essential role in maintaining healthy blood pressure throughout life. Regular physical activity keeps blood vessels flexible and improves circulation. Balanced nutrition supports cardiovascular health. Staying hydrated helps maintain stable blood pressure levels. And maintaining good sleep habits contributes to overall cardiovascular regulation. None of these habits replace medical care, but together they form a powerful foundation for long-term health. When combined with personalized treatment and careful monitoring, they can help maintain strong circulation and support independence well into older age. What you now understand is something many people never hear clearly explained. Blood pressure management in older adults requires balance, awareness, and individualization. Numbers alone never tell the whole story. The goal is not simply to achieve a perfect reading but to support the body's natural ability to function safely and efficiently. When blood pressure is managed thoughtfully, older adults can reduce the risk of both cardiovascular disease and dangerous falls. They can maintain energy, mental clarity, and independence. And they can approach aging with confidence rather than fear. If this information helped you see blood pressure in a new light, share it with someone you care about. Many people over 60 or 70 are still following outdated ideas about what their numbers should be. Helping them understand this new perspective could make a real difference in their health and safety. And remember, while research continues to evolve, any changes to medications or treatment plans should always be discussed with a qualified healthcare professional who understands your full medical history. Knowledge empowers you to ask better questions and make better decisions, but those decisions should always be made together with your doctor. Your health is not defined by a single number on a screen. It is defined by how well your body functions, how stable your circulation remains, and how safely you can live your daily life. When those factors are balanced, blood pressure becomes not just a measurement but a tool for maintaining a long, active, and healthy life.